MCQs for Clinical Laboratory Scientists and Technologists License Exam Part 8. By Tariq Hammam.
Urinalysis and body fluids MCQs. Which of the following is inappropriate when collecting urine for routine bacteriologic culture? A. The container must be sterile. B. The midstream void technique must be used. C. The collected sample must be plated within 2 hours unless refrigerated. D. The sample may be held at 2 to 8 degrees Celsius for up to 48 hours prior to plating. The correct answer is D. Urine specimens should be plated and incubated within 2 hours of collection. Some labs use a 1-hour time limit, and within 24 hours if the sample is refrigerated at 2 to 8 degrees Celsius immediately following collection. No additives are permitted when urine is collected for culture.
Which statement about sample collection for routine urinalysis is true? A. Preservative tablets should be used for collecting random urine specimens. B. Containers may be washed and reused if rinsed in deionized H2O. C. Samples may be stored at room temperature for up to 2 hours. D. First morning voided samples are not acceptable when renal disease is suspected. The correct answer is C. The first morning voided sample is the most sensitive for screening purposes because formed elements are concentrated, but random samples are satisfactory because glomerular bleeding, albuminuria, and cast formation may occur at any time. Preservative tablets should be avoided because they may cause chemical interference with some dry reagent strip and turbidimetric protein tests. Changes in glucose, bilirubin, and urobilinogen can occur within 30 minutes of collection. Therefore, samples should be refrigerated if not tested within 2 hours. Which of the following contributes to specific gravity, but not to osmolality? A. Protein. B. Salt. C. Urea. D. Glucose. The correct answer is A. All substances that dissolve in the urine contribute to osmotic pressure or osmolality. This includes non-ionized solutes such as urea, uric acid, and glucose as well as salts, but not colloids such as protein and lipids. Urine with a specific gravity consistently between 1.002 and 1.003 indicates A. Acute glomerulonephritis. B. Renal tubular failure. C. Diabetes insipidus. D. Addison's disease. The correct answer is C. In severe renal diseases, the tubules fail to concentrate the filtrate. Salt and H2O equilibrate by diffusion, causing a specific gravity of about 1.010. If the Sg of urine is below that of plasma, free H2O is lost. This results from failure to produce ADH, inherited diabetes insipidus, or from failure of the tubules to respond to ADH, nephrogenic diabetes insipidus, which can be caused by drugs, polycystic kidney disease, and hypercalcemia. Which ratio of anticoagulant to blood is correct for coagulation procedures? A. 1 to 4. B. 1 to 5. C. 1 to 9. D. 1 to 10. The correct answer is C. The optimum ratio of anticoagulant to blood is 1 part anticoagulant to 9 parts of blood. The anticoagulant supplied in this amount is sufficient to bind all the available calcium, thereby preventing clotting. The anticoagulant of choice for most routine coagulation studies is A. Sodium oxalate. B. Sodium citrate. C. Heparin. D. Ethylenediamine tetracic acid EDTA. The correct answer is B. The anticoagulant of choice for most coagulation procedures is sodium citrate, 3.2%. Because factors V and 8 are more labile in sodium oxalate, heparin neutralizes thrombin, and EDTA inhibits thrombin's action on fibrinogen. These anticoagulants are not used for routine coagulation studies. Which results would be expected for the prothrombin time, PT, and activated partial thromboplastin time, APTT, in a patient with polycythemia? A. Both prolonged. B. Both shortened. C. Normal PT, prolonged APTT. D. Both normal. The correct answer is A. The volume of blood in a polycythemic patient contains so little plasma that excess anticoagulant remains and is available to bind to reagent calcium, thereby resulting in prolongation of the PT and APTT. For more accurate results, the plasma anticoagulant ratio can be modified by decreasing the amount of anticoagulant in the collection tube using the following formula: 0.00185 V 100-H equals C, where V equals blood volume in ml, H equals patient's hematocrit, and C equals volume, ml, of anticoagulant. A new sample should be drawn to rerun the PT and APTT. What reagents are used in the PT test? A. Thromboplastin and sodium chloride. B. Thromboplastin and potassium chloride. C. Thromboplastin and calcium. D. Actin and calcium chloride. The correct answer is C. Thromboplastin and calcium, combined into a single reagent, replace the tissue thromboplastin and calcium necessary in vivo to activate factor VII to factor VIIA. This ultimately generates thrombin from prothrombin via the coagulation cascade. Which test would be abnormal in a patient with factor X deficiency? A. PT only. B. APTT only. C. PT and APTT. D. Thrombin time. The correct answer is C. Factor X is involved in the common pathway of the coagulation cascade, therefore, its deficiency prolongs both the PT and APTT. Activated factor X along with factor V in the presence of calcium and platelet factor III, PF3, converts prothrombin, factor II, to the active enzyme thrombin, factor IIa. Which of the following characterizes vitamin K? A. It is required for biological activity of fibrinolysis. B. Its activity is enhanced by heparin therapy. C. It is required for carboxylation of glutamate residues of some coagulation factors. D. It is made by the endothelial cells. The correct answer is C. Vitamin K is necessary for activation of vitamin K-dependent clotting factors 2, 7, 9, and X. This activation is accomplished by carboxylation of glutamic acid residues of the inactive clotting factors. The activity of vitamin K is not enhanced by heparin therapy. Vitamin K is present in a variety of foods and is also the only vitamin made by the organisms living in the intestine. Which factor deficiency is associated with a prolonged PT and APTT? A. Factor 10. B. Factor 8. C. Factor 9. D. Factor 11. The correct answer is A. Factor X, a common pathway factor deficiency, is most likely suspected because both PT and APTT are prolonged. Other causes may include liver disease, vitamin K deficiency, and anticoagulant drugs such as Coumadin and heparin. What is the American Diabetes Association recommended cutoff value for adequate control of blood glucose in diabetics as measured by glycated hemoglobin? A. 5%. B. 6.5%. C. 9.5%. D. 11%. The correct answer is B. The ADA recommends that 6.5% be used as the cutoff for determining the adequacy of treatment for diabetes. A glycated hemoglobin test should be performed at the time of diagnosis and every 6 months thereafter if the result is less than 6.5%. If the result is 6.5% or more, the treatment plan should be adjusted to achieve a lower level, and the test performed every 3 months until control is improved. Which statement regarding measurement of hemoglobin A1C is true? A. Levels do not need to be done fasting. B. Both the label and stable hemoglobin A1C fractions are measured. C. Samples should be measured within 2 hours of collection. D. The assay must be done by chromatography. The correct answer is A. Since hemoglobin A1C represents the average blood glucose 2 to 3 months prior to blood collection, the dietary status of the patient on the day of the test has no effect upon the results. Refrigerated whole blood samples are stable for up to 1 week. HbA1c is assayed by cation exchange high-performance liquid chromatography or immunoassay, immunoturbidimetric inhibition, because both methods are specific for stable HbA1c and do not demonstrate errors caused by abnormal hemoglobins, temperature of reagents, or fractions other than A1c. Which of the following is the reference method for measuring serum glucose? A. Samaji, Nelson. B. Hexokinase. C. Glucose oxidase. D. Glucose dehydrogenase. The correct answer is B. The hexokinase method is considered more accurate than glucose oxidase methods because the coupling reaction using glucose 6-phosphate dehydrogenase, G6PD, is highly specific. The hexokinase method may be done on serum or plasma collected using heparin, EDTA, fluoride, oxalate, or citrate. The method can also be used for urine, cerebrospinal fluid, and serous fluids. Which statement about glucose in cerebrospinal fluid, CSF, is correct? A. Levels below 40 mg per deciliter occur in septic meningitis, cancer, and multiple sclerosis. B. CSF glucose is normally the same as the plasma glucose level. C. Hyperglycemia is caused by dehydration. D. In some clinical conditions, the CSF glucose can be greater than the plasma glucose. The correct answer is A. High glucose in CSF is a reflection of hyperglycemia and not central nervous system disease. The CSF glucose is usually 50% to 65% of the plasma glucose. Low levels are significant and are most often associated with bacterial or fungal meningitis, malignancy in the central nervous system, and some cases. Thank you for watching. Like, share, subscribe. To see next video. MCQs Part 9.